I'm an EMT. What can I do for you? Why about chest pain? Oh, chest pain. Why don't you tell me about that? Where are you feeling? Oh, sorry. When did the chest pain begin?
20 minutes ago.
What were you doing when it started?
I was pushed up in.
How does it feel? How would you describe it? Is it dull? Is it sharp? Is it stabbing?
Dull, but like pressure also.
Okay. On a scale of 1 to 10, if 10 is the worst, how bad is it?
An 8.
Does it go anywhere, or does it stay in one spot?
Going kind of down my arm also.
Okay. Have you ever had this discomfort before?
No.
Does it come and go, or is it constant?
Constant.
Okay. So now I've OPQRST, the chest pain. I got to the bottom of that. I'm now at the point where I can call for ALS, because now I've identified a chest pain patient. I'm going to continue my exam by doing a physical exam. Challenging things between sexes, right? I have to evaluate the chest in a way that nobody watching would think is totally inappropriate. And that's a challenge, but this is how you do it. Where are you having that chest pain? Does it hurt if I push right there on that area?
No.
How about like this? I'm going to push on your ribs and take a deep breath. Let me know if that hurts you.
Cool.
A little bit? Okay. I'm also going to feel your abdomen. Any discomfort here when I push? At this point, I'm feeling for any masses, pulsatile masses, and looking for guarding, which is when I push, she goes, ooh, brr. Now I'm going to get my stethoscope, and I'm going to do lung sounds. Take a deep breath, in and out. Deep breath in and out. Again. Again. Lean forward a little bit. Again. And again. So now I've done my OPQRST. I've done my focused physical exam. I'm going to do my sample. Do you have any medical problems? Hypertension, diabetes, etc., etc. Do you take any medicines for that?
Yes.
I take aspirin once a day. I take nitro. I take hydrochlorothiazide. Do you have any allergies to medicines? No. Perfect. So now I've done my OPQRST, my sample, my focused exam. I've got vital signs from my partner. Now is the time when I treat the patient, which is go to the aspirin. I want to administer 324 milligrams, and I have to see if this is what I should do, right? Are you allergic to aspirin?
No.
Have you had any aspirin within the last hour?
No.
Blood pressure is
128/80.
not greater than 180 systolic. Do you have any active GI bleeding or vomiting or dark tarry stool or anything like that?
No.
Okay. I'm going to administer 324 aspirin. Why don't you go ahead and chew that? Chew, chew, chew. Next, I'm going to evaluate whether or not I can assist with nitroglycerin. You have a prescription for nitroglycerin. Have you used any of it today?
No.
Can you show me the bottle? You're not allergic to nitro?
No.
This is you. This is not expired. Any erectile dysfunction medicines? Okay. I'm going to, blood pressure is greater than 100.
Yeah.
So I'm going to administer a nitroglycerin under your tongue and then continue to evaluate. And I can administer up to 3, assisting her with that. Checking vital signs in between every 5 minutes. And ALS is coming. If you were to go into cardiac arrest, swoon like that. Oh, guys, she's passing out. Come help me. Let's lift her to the ground. Here's now my patient. Ma'am, are you there? Wake up, unresponsive. Carotid pulse check, no pulse. Start CPR, get the bag valve mask. Prior to CPR in progress, upgrade BLS, second BLS unit. Now I'm grabbing the AED and we're in that CPR game. Good. Questions on that?